Good evening to everyone and welcome to today's wonderful evening with Dr. Shraddha. And we are really proud to have a NEET PG Topper who is doing her MS General Surgery from the prestigious Aurangabad Medical College. Shraddha, what is the rank you got in NEET PG?
So I got 4,937, and first of all, good evening one and all. I'm feeling really grateful to this platform for giving me an opportunity. And I know the preparation period is so difficult. We need people around us to support us. And I feel it's a blessing for me to support people who are going through this phase. And let's hope for best as we can help them as much as possible.
Great. So a lot of times, NEET PG preparing students have a lot of doubts. How to crack exam, how to, should we make a notes or not? So many questions in the mind. So
yes, sir.
We guys have cracked a top rank almost 22 years back. So for the today's world, the so-called senior teachers like us are obsolete because in our days, the competition was not this much, and of course, uncertainties were the same. That if you don't get seat, you don't get a girl to marry, and if you don't get the seat, you can't settle down in life. Those insecurities were there even in those days also. So
those things are still there today.
Yes, that's right. So that is the reason. What I thought is, instead of some national faculty or somebody, let us bring those who are doing their post-graduation, who cracked the entrance exam. Regularly, every day, we will have a 1 hour boxing show so that we ask the questions, you answer. You give 1 point that a NEET PG preparing student need to remember. So that is how these sessions are all planned for. And really thanks for joining this session, Dr. Shraddha. Let's make the great beginning. And Anita, Yash, Ramanuj, and many more who are all online, most welcome. Now, you're able to see the question on the screen, am I right?
Yes, sir.
Yeah, that's good. Good to see Dr. Shailaja, Achan Khan, and many more. We are today full floor to see how are we going to do the batting with Shraddha. So, yes. One minute.
Yes, so we can start the session.
Yeah, just I'm setting the PPT.
Yes,
yeah, that's good. So let's make the great beginning, doctor. What do you think is the most common cause of acute pancreatitis?
Biliary calculus, sir. And the googly here is the alcoholism, because as soon as we think of acute pancreatitis, we run towards alcohol. So you just have to, stand, think for a second, and then answer this question. The answer is biliary calculus.
Great, that's wonderful. So it is the biliary calculus. Now, about the gout, what is a true statement about? What is not a true statement in this?
So the answer
actually, this is option B is teetotalers, not teetotalers. Teetotalers, that is those who don't drink alcohol. So what is your call about it?
The answer is C, not found in women after menopause.
Okay. You mean to say it is found in the women after menopause?
Yes, sir.
Okay. Good. Now, what is the treatment of thyroid crisis? Thyroid crisis. How do you want to manage a hyperthyroidism patients who are presenting with crisis? What is accepted about it?
So the answer to this question is iodine. It's just simple logic that we use iodine for treatment of hypothyroidism, and rest others they're all drugs for use in thyroid crisis. Neomethimazole, propranolol for hypertension, and iodide for decreasing the synthesis of thyroid hormones.
Wonderful. Now, nephrotic syndrome, what are the various 1, 2, 3, 4, 5 causes of nephrotic syndrome is a favorite question.
Yes, sir.
So what's your answer?
And the answer to this is atherosclerosis. It's the rest all are actually the causes of nephrotic syndrome.
Absolutely. So what is the major cause of nephrotic syndrome in elderly people? So typically, it is the membranous glomerulopathy is the most common cause in the elderly people, whereas in the case of the children, it is the minimal change disease. Another very important point we need to remember when we take the entrance exam is, whenever an elderly person is having the nephrotic syndrome, and we happen to discover membranous nephropathy, always we should look for lymphoma. Underlying lymphoreticular malignancy should always be suspected whenever an elderly person presents with nephrotic syndrome and found to have membranous nephropathy. That is point number 1 that you need to remember. And second important point you should know is nephrotic syndrome typically in adults, whenever it is presenting, if there is a massive proteinuria, that is proteinuria more than 2 grams, if it is there, you should always think the possibility of FSGS, focal segmental glomerulosclerosis, as the underlying cause of a massive proteinuria in case of the nephrotic syndrome is what you need to remember. Very good. Shrinking lung syndrome, where do you see, doc? Your voice is not coming. Yes, doctor. I think you are getting called from the hospital.
Yes, sir. Sorry for the disturbance. Actually on duty also, but I'm sorry. Okay.
Thank you.
Answer to this question. Hello.
Yeah. You're audible. Doctor.
Sir, I'm not able to hear your voice actually. Can you just check once?
No. I'm able to hear your voice, doctor. Please go ahead and shoot your answer. You can shoot it. Yeah, you can shoot your answer, doctor. You're audible.
Hello.
You're still audible, doctor.
Hello.
Yeah, you're audible.
Sir, are you able to hear me? I'm not able to hear you, any.
Okay, 1 minute. Now can you hear me, doctor?
Yeah, yes, sir. I'm now able to hear you.
Good. So now you can shoot. What is your answer for this question?
This is systemic lupus erythematosus. It's the shrinking lung syndrome. It's seen in SLE. And actually, to tell you, SLE is one such topic where a large number of questions can come. So autoimmune disorders can be one such topic where students really need to concentrate. A lot of questions they can get image-based, audio-based, video-based, and n number of questions, especially according to the new pattern that is coming in NEET PG.
Absolutely. SLE is most important topic. Tonight only all our students need to review. Dr. Shraddha, our topper, endorses the importance of reviewing SLE as the most high-yield topic, doctor. Very good. Now, photosensitive reaction. Do you think which is the drug that can lead to photosensitive reaction?
So the drug which that causes photosensitivity reaction among the following except pioglitazone, it's an oral hypoglycemic drug. So that is the answer for this question.
Very good. So pioglitazone is basically the one which lead to the release of it helps to sensitize the tissues to the insulin sensitivity. So thiazide, chlorpromazine, tetracycline, the three important drugs we need to remember when it comes to the photosensitivity reaction. So now my question to you, Shraddha, while you are preparing for entrance exam last year,
Yes.
you used to get this kind of list kind of things. How do you used to manage to remember all these stupid lists that will bother every entrance aspirant's mind? Is there any secret for you that you want to tell people?
Not actually, sir. What one thing I stupid silly questions in a separate book, and whenever I used to just get tired of reading a subject on continuous basis, I would just go back to the book, just turn the pages. You need not just sit and keep on, reading everything. Just turn the pages. You will get the photographic memory by the time you finish your preparation.
My next question will be, what did you do with your silly questions book after you cracked the NEET PG exam? Can you be able to donate us so that we can be able to distribute it to all our students? Is there any possibility? You still have that silly book with you, or you forgot that after getting seat into PG?
I have given the book to my juniors. I don't know what is its condition presently, but I would surely try to get back to you if I find that book back.
Good, very good. So the very important advice to every aspirant is, Shraddha asks you to keep that silly separate book to remember this kind of lists and crack them. Very good. Now, doctor, hospital acquired pneumonia, what is commonly used in the treatment?
So the answer to this question is hospital-acquired pneumonia treatment includes all except penicillin.
Great. So imipenem, gentamicin, ceftriaxone. Typically, yeah. Very good. So imipenem is also commonly available as ferropenem. So this is used whenever the patients are having urinary tract infections which are not responding. Quite often ferropenem is very, very effective. Then often the aminoglycosides have a great role combined with cell wall synthesis inhibitor like ceftriaxone is what you need to remember. Now about the nosocomial infections, what is except out of this?
It's actually tobacco smoking, sir. This question can be answered actually by ruling out method also. Nosocomial infections you can count into the atelectasis, pneumonia, UTIs and all. Aspiration of GI material and aspiration while endoscopy, they very commonly have come across to at least last 9 months of my residency. A lot of patients go into poor prognosis just because of aspiration. And diabetes nowadays is one such factor. It is affecting our immunity the most. So this we need not remember every question like by heart every question. Some things can be answered based on the ruling out technique as well.
Very good. That's really a wonderful point. Don't need to by heart everything. That is a wonderful secret of a topper that we have heard today from Dr. Shraddha. A lot of students go into apprehension. Maybe I need to by heart, etc. Really not required. You can rule out, use the rule out technique. Common sense, which is uncommonly available in the human life. Rule out technique is the one more common sense is going to save, not always the knowledge. Very good point. So macrocytosis, where do you see? Except
the answer for this is thalassemia. And just to make a point here, we can also have a small one-point discussion. It's also a component of SITA, which are the 4 commonest causes for microcytic hypochromic anemia. So sideroblastic anemia, iron deficiency, thalassemia, and aplastic crisis.
Wonderful. So sideroblastic anemia, iron deficiency anemia. C for what, doctor?
SITA, thalassemia.
SICA, Sita. Oh, Rama Sita. Very good. Beautiful, beautiful way to remember, Dr. Shraddha. I will tell for another 20 years that Shraddha taught me today to remember Lord Sita in order to remember the microcytic anemia. S for sideroblastic anemia, I for iron deficiency, T for thalassemia, A for what, doctor? Anemia of chronic disease.
Yeah, anemia of chronic disease. I'm sorry, anemia of chronic disease.
Wonderful, wonderful, doctor, wonderful. Now, what is the earliest change in iron deficiency anemia?
It's reticulocytosis, sir. Very typical question. We can come across n number of times. Your retic count is high. The first diagnosis comes to be iron deficiency anemia.
Good. Actually, generally reticulocytosis, brisk reticulocytosis, whenever it is there, we generally think of hemolytic anemia, actually, in the real clinical practice. So, hemolytic anemia, because in hemolytic anemia, bone marrow has no problem. Bone marrow is able to produce the RBC, but RBCs are killed in the periphery. So, that is the reason what will happen, the bone marrow compensates to produce reticulocytosis. But in many other conditions like deficiency states, like iron deficiency, once you start iron therapy, then reticulocytosis becomes brisk. So probably the question frame is not very appropriate. The right question frame should be decreased ferritin is one of the early changes of iron deficiency.
Yes. Yeah. Not in the option, yes, sir.
That's right. So next, pure motor neuron disease is seen in all this except.
The answer for this is subacute combined degeneration, sir. And it's very simple. Rest all have your motor neuron problems, whereas subacute combined degeneration is a mixed kind of disease.
Absolutely. Poliomyelitis involves anterior horn cells. That's the reason it is purely motor. Lead poisoning is one of the 5 or 6 causes. Shraddha's silly question book will definitely have that listed, right? So, lead poisoning is one of the causes of pure motor neuropathy, pure sensory neuropathy. You should make the list to remember. Then amyotrophic lateral sclerosis also involves anterior horn cells. So, it leads to LMN features in the upper limb and UMN features in the lower limb classically. But because subacute combined degeneration involves dorsal columns which are carrying position and vibration. So they are the position and vibration. So they are carrying sensory. So that is the reason sensory involvement is also there in subacute combined degeneration. That's how it becomes the answer. Very good. Now, doctor, paradoxical respiration, where do you see?
The answer for this is multiple fracture rib, and it's actually nothing but the flail chest. So normally when we inspire, our chest should move out, but in the flail chest, the flail segment, you inspire and that part segment moves inside. So that is what is known as paradoxical respiration.
Absolutely. Wonderful, wonderful, doctor. Now, pink frothy expectoration.
The answer for this is pulmonary edema, and it's most commonly seen secondary to heart failure and many such all secondary symptoms. So this can also be added to our silly question book, where it can be a list causes for pulmonary edema also.
Wonderful, wonderful, doctor. Now, about exudate versus transudate, that is the Light's criteria. So what is except out of this?
The answer is protein less than 1 gram. So because it's a feature of transudate, exudate has quite good amount of protein in it.
Wonderful. Now, with regard to the emphysema, what is exact? Emphysema?
I think they are all the features of emphysema, sir. I don't find anything where I can mark it as an except, because your alveoli are damaged, your vital capacity is decreased, your lungs are hyperinflated, and bronchi obviously is a feature of emphysema as well.
Right. But basically, if you look at emphysema or bronchitis, they come under COPD. In COPD, the residual volume increase. Residual volume is a part of the vital capacity. So that is the reason there is not much of significant decrease in vital capacity, unlike the interstitial lung disease, where you have a significant decrease of the vital capacity. That's the spirit of this question.
Yes, sir.
Now, but otherwise also there is not a very clear answer out of all this. Now, digoxin, where is it contraindicated?
Digoxin is contraindicated in hypertrophic cardiomyopathy, sir.
Could you be able to explain the reason for that? Okay, I will explain, not a worry. So basically what is happening in hypertrophic cardiomyopathy? You have an interventricular septum and you have a mitral leaflets. This is left atrium, left ventricle, right? So from the left ventricle, the blood is going into aorta. So now what's happening in case of HOCM is the blood which is coming into left ventricle has to go into aorta. So the anterior mitral valve leaflet and this hypertrophic septum touch each other. And that will cause a dynamic obstruction to the outflow of the blood from left ventricle into aorta. So what happens is, if you give a beta blocker, if you give a digoxin. So digoxin increases the inotropic state of the heart. The moment it increases inotropic state, what will happen? The heart contracts strongly and then it pushes a lot of blood into aorta. And because it pushes the blood into aorta, because it pushes the blood into aorta, the size of the ventricle becomes smaller. A smaller ventricle will cause more amount of touching between the the anterior mitral valve leaflet and interventricular septum, and that will worsen the obstruction. So that is the reason digoxin is contraindicated if there is a hypertrophic cardiomyopathy, because it typically causes a smaller ventricular size and increase the touching between anterior mitral leaflet and the interventricular septum and increase the left ventricular outflow obstruction. That's the reason. Otherwise, in all other conditions, digoxin is very much indicated. Do you know, Shraddha, why digoxin is indicated in atrial flutter? No problem. Yeah. So basically, digoxin has got a vagomimetic activity.
Yes, sir.
So because of this vagomimetic activity, it will lead to AV nodal block, right? Now, if you take the atrial flutter, there is a lot of zigzag electrical activity in the atria, and we don't want all that activity to go into ventricle. So anything that causes AV node become refractory is a wonderful drug. That is the reason for the vagomimetic activity of the digoxin, to slow the ventricular rate and prevent the atrial flutter from going into ventricle. We want to induce the AV nodal refractoriness, for which we use the digoxin. Excellent. Now, come on, doctor. What is your answer for this?
The answer for this is iron deficiency anemia, which we usually see in a lot of children eating clay, paints from the walls. So, very simple question. We can try this out.
Absolutely. Great. This is a very simple question. Now, anxiety disorder. Which medical disorder mimics?
So the answer for this is alcohol withdrawal, because hyperthyroidism, pheochromocytoma, both of them increases your metabolic activity, you have anxiety. Coronary artery disease, even before your chest pain, you have symptoms like of anxiety. So the answer for this is alcohol withdrawal.
Wonderful, wonderful, doctor. Now, suicide tendency, where do we see?
Depression, the most common.
Absolutely. And in fact, the presence of depression with suicide tendency is an indication for electroconvulsive therapy is one of the favorite.
Yes,
yeah.
sir.
So any other point you have in mind?
So actually there are 4 to 5 MCQs that can be seen here, like the most common cause of depression, most common cause of depression in males, most common cause of depression in females, then the most common way of suicide in males, females, most common mortality, whether males or females. I think some 7 to 8 MCQs come across when this topic has been chosen to discuss.
Wonderful. So once more, Shraddha's silly question book will contain all that list, and Dr. Shraddha promised us that she is going to donate that to all the future NEET PG toppers who are sitting on the other end of the game. I'm really happy to see almost 26 future toppers in NEET PG. Neha, Gupta, Anita, and many more. So keep punching your answers and keep punching your specific questions also, doctor. Very good. Now, antipsychotic drugs, and we're showing dopaminergic blockade. What is the side effect because of that?
The answer to this question is dry mouth.
Okay. True. And in fact, antipsychotics are D1, D2, D3, D4 blockers.
Yes, sir.
So D4 blockers. So that is the reason Parkinsonism is one of the common effects that occur because of the antipsychotics dopaminergic receptor blockade actually. So good. Now, steatotic eczema. So what is true about it?
So the answer to this question is leads to pre-malignant condition. Rest all are the true points about steatotic eczema. Actually, the word steatosis covers everything. It's like loss of fat leading to eczema. So it's xerotic because there is dryness, there is itching. Since it is eczema, there has to be itching. And your normal topical moisturizers do help out. There's nothing to do with your pre-malignant condition or something like that.
Excellent, excellent, doctor. Now, lupus vulgaris.
So the answer to this question is skin tuberculosis. And this topic under dermat, there are some 5 MCQs. There is some common cause for lupus vulgaris. Then there is some apple jelly appearance of the skin. And I think the treatment to this thing is also a point for MCQ in lupus vulgaris.
Absolutely. So most commonly, image-based MCQs are all on the apple jelly appearance on diascopy. Whenever you press with a white glass, you find apple jelly appearance. The favorite question about lupus vulgaris.
Yes, sir.
Now, where are the antibodies acting on the Pemphigus vulgaris?
So the answer to this question is the intercellular substance.
Great. And any points, 1-2 points you want to tell about Pemphigus vulgaris?
So Pemphigus, there are both the variants can be studied as a comparative study so that a lot of points can be remembered in this.
Okay. So one common thing you can remember is bullous pemphigoid is all elderly people.
Elderly people, yes.
Pemphigoid is tense bullae. Then Pemphigus vulgaris is all flaccid bullae. And typically oral involvement is one important differentiator. And
yes.
Commonly bullous pemphigoid can even exist as a paraneoplastic syndrome. That's the point favorably asked, but otherwise into your silly question book, this important table should go, and with your classmates in the reading room, you need to make a revision, right? Now, doctor.
And I think on the appearances, when we use antibodies to detect it, the appearances also their MCQ high yield questions.
Absolutely.
Exactly.
Immunofluorescence appearance of dermatitis herpetiformis versus Pemphigus vulgaris versus bullous pemphigoid is one of the favorite topic of the examiner. Absolutely, absolutely. So how do you treat tinea versicolor, doc?
So the answer to this is except is corticosteroid. Rest everything you use for the treatment of tinea versicolor.
The ketoconazole, selenium sulfide, and what is tinea versicolor because of? After becoming a surgeon, you are still remembering tinea versicolor?
I asked.
Malassezia furfur. So, Malassezia furfur. And one more important point we need to remember is the appearance of spaghetti meatball appearance.
Spaghetti meatball appearance, exactly, yes, sir.
Yeah, spaghetti meatball appearance is another favorite MCQ in the tomorrow's NEET PG exam. So I'm really delighted to see almost 30 students online, and every day we are going to have 1 hour of NEET PG fight show. NEET PG fight, we call this show as, so that it inspires us, you know, how the NEET PG toppers who are doing their first year MD, definitely there is a lot of requirement to learn emotional support that we can get from the people who got cracked the seat last year, who passed a similar life experience like us today. But also knowledge-wise, why not? Let's have a combined study with the NEET PG toppers every day is the goal. I hope you will spread this message, everybody who are online, that share it in the WhatsApp group, etc. And another thing is, we have completely democratized learning. Generally, a lot of coaching centers commercially charge 50,000, 60,000 rupees for the coaching program. If it is a face-to-face class, it is understandable because there's a lot to arrange the classes. But online learning can be given for even 1 rupee also. So that is the reason for 999 rupees, we give 3 years access, where you get 800 hours of video library, 500 hours of live online classes every year, 35,000 PowerPoint slides of notes, and 60,000 MCQ question bank, and also, 1 minute. And also, you get 60 full-scale grant tests on every Sunday, and we want to start a new style of Sunday mock test discussion, where one of the topper or a couple of toppers can be able to, like a chai pe charcha, we can be able to do the revision of all the 200 questions instead of some teacher coming and teaching. I think that is much more physiological way of learning. So, doctor, yeah, 1 minute. Yeah. So the next question, triple therapy of H. pylori, what does it not include?
So it doesn't include sucralfate, because that is used for your soothing of the ulcers that has already caused, and treatment of H. pylori has only omeprazole, clarithromycin, and metronidazole.
Absolutely, doctor. Really, Dr. Shraddha is a very confident surgeon. You know, people get confidence to see Dr. Shraddha if she says that I'm going to operate you today. So Shraddha, I'd like to ask you, what is your longer dream? You want to be a neurosurgeon, cardiothoracic surgeon, or surgical gastroenterologist? What is your dream?
So actually, I haven't thought anything much, but neurosurgery is actually fascinating me these days a lot. So let's hope. I need everybody's blessings to reach such high point in my life still.
Definitely, definitely. One day will come where you have day in and day out to operate. So in fact, one of my co-founder of this Incus, my co-founder is a neurosurgeon, Dr. Thirumal, and he's one of the toppers who got MCH in first attempt after emergent surgery. He's my co-founder. We both started this startup called Incus to offer in 1 rupee. How can we offer NEET PG coaching and also MBBS subject coaching for the students just for 1 rupee, 1 rupee cost? Is it possible? It is very much possible because Incus app has all that video library, everything. Whether 1 lakh students take the subscription or 1 student takes subscription, cost is going to be same for us. Then why we should charge exorbitantly plan A, plan B, plan C and all that commercial plans? Because we are doctors and we are all doctors. There's no point in charging, and it is also a social responsibility. Tomorrow you get trained, you top the entrance and you are going to treat the people and save many more lives. So that is the reason, please call 9000868356. Just pay 999 rupees and you get 1000 days. That is 3 years of access to the entire video library, both app and also on the online MBBS web. Now, doctor, the next question. Increased incidence of HIV in pulmonary TB.
Mycobacterium tuberculosis.
Obviously. And also a typical mycobacterium also common. And what is extradural hemorrhage due to?
The middle meningeal artery is the most common cause of extradural hemorrhage, sir.
And where do you see lucid interval, doctor?
Same, sir. Extradural hemorrhage where there are a period of consciousness between 2 period episodes of unconsciousness.
Absolutely. And extradural versus subdural hemorrhage, which is a venous bleed?
The subdural hemorrhage is the venous bleed, sir.
And a biconvex appearance, where do we see that?
Is seen in EDH and biconcave appearance is seen in SDH.
Absolutely right. And dementia is the presenting feature in case of chronic subdural hemorrhage.
Chronic subdural hemorrhage, yes, sir.
And tomorrow we will have one in surgery. We will have a complete 60 questions rapid fire boxing fight with Shraddha on NEET PG surgery. Only all 60 minutes is 100 images rapid fire. We will do a revision, doctor. Are you ready? Yeah, I think we missed the Shraddha. She's on a duty, and in spite of the duty, she promised to be with all of us to participate in the discussion. Before Shraddha joins back, I will continue with the remaining questions. Folic acid supplementation is to reduce the neural tube defects, all of you know. What stimulates the growth hormone release? Octreotide is the drug which is known to stimulate the growth hormone release. And the non-endocrine function of the increased prolactin. 1 minute. Be online, doc. Before Shraddha joins, let us quickly have one presentation. Great. We have the Shraddha back with us.
I'm sorry,
Really, thank you.
for the disturbances, sir. I'm actually on duty and I need to answer the grievances of the patients as well. I'm really
No, that
sorry.
is always duty calls first. The hands that work are holier than the lips that pray.
COVID. I have 40 patients under me and obviously relatives are too apprehensive. So I need to answer them and I'm really sorry for the interruption.
No, really, thank you so much, doctor, for giving your time. And also, there are 20 more questions. If you can, we be able to finish it quickly in another 20 minutes?
Yes, sir, no problem. I can manage, no problem.
Yeah,
I just need a little bit of your cooperation. That's it, nothing else.
Great, doctor. Great. I'm really proud of you. 1 minute. Yeah. Let me share this one.
Yes, sir.
Yeah. So now let us ramp up into our second round of the boxing show. Now, doctor, what is the most common cause of the death in diabetic ketoacidosis?
So, the answer for this is cerebral edema, sir.
Actually, DKA typically occur in children and with type 1 diabetes, first time when they get detected, and especially in children, only in children, it is very specific. Cerebral edema is a specific complication more often seen in the case of children that can lead to the development of mortality. But whenever a child presents with diabetic ketoacidosis, we should aggressively manage so that no stones unturned. Any child should survive the attack of diabetic ketoacidosis with a good fluid management and the insulin therapy and electrolyte management. Now, Miller-Fisher syndrome, what is the triad? Can you be able to see, doc? Yeah, can you be able to see, doc?
Yes, sir, I'm able to see. Yes, sir.
Yeah. So, what is the triad of Miller-Fisher syndrome?
Ataxia, ophthalmoplegia, and oreflexia. And this can also be given as they can give you 4 features and they can ask you to rule out one, or they can give you 4 features and ask you to choose one. So this can be given in any way.
Absolutely. And Miller-Fisher is the variant of the Guillain-Barré. And Guillain-Barré is an example of asymmetrical acute flaccid paralysis. Acute flaccid paralysis, just like poliomyelitis. Unlike the poliomyelitis, which is asymmetrical, this can be symmetrical. And so that are the important points to remember. And another thing is, regular wala Guillain-Barré mein there is no ophthalmoplegia, but Miller-Fisher variety mein ophthalmoplegia add hota hai. That is a point to be remembered. Okay. Psychic moans, abdominal groans, stones and bones. Where do we see them?
So the answer to this is primary hyperparathyroidism.
Absolutely. So in primary hyperparathyroidism, commonly is because of what, doc?
Hello? Yes,
Hello?
sir?
Primary
Yes,
hyperparathyroidism, what is the most important cause? It is the parathyroid adenoma. which is
Yes, sir.
the most common cause. And always hyperparathyroidism is synonymous with hypercalcemia. Hypercalcemia. And hypercalcemia lead to your grown stones, bones, etc. Good.
Yes.
Kernhohn-Woltmann phenomena. Where do we see that?
So it's seen in transtentorial herniation because of it. The cause can be anything, bleed, tumor, anything. A transtentorial herniation causes Kernhohn-Woltmann phenomenon.
Absolutely. So typically, if you look at the brain, you have the temporal lobe and the oculomotor nerve is coming out closer to that. So whenever there is any increased pressure, let us say on one side, then it leads to the false localizing sign on the contralateral side. That can lead to the compression of the oculomotor nerve, and that can lead to development of pupillary dilatation. So that's what we need to remember. Now, massive hematolysis has splenomegaly. What is the most important source of bleeding, doctor?
This points us to portal hypertension, sir. And the point that is related, I can see, is only one, esophageal varices.
Absolutely. It is the esophageal variceal bleeding, which is associated with the hematolysis. And once more, portal hypertension can be because of extra hepatic portal vein obstruction. Extra hepatic portal vein obstruction. So this is one of the favorite topic that every student today evening after this session is over, you need to pick it up, and then in your silly short question notebook, you need to be very sure with at least 5 to 6 points on the EHPVO. Now, doctor, what is the drug of choice for actinomycosis?
Hello, yes, sir.
What is the drug of choice for actinomycosis?
The drug of choice is penicillin, sir, for actinomycosis.
Absolutely. There is one more place where penicillin, in spite of Alexander Fleming dying so many years ago, it is still effective. That is leptospirosis. Is another situation where penicillin is very effective. Even ceftriaxone is also effective in leptospirosis, is what you have to remember. Pleural effusion, tapping, where will you do, doc?
So the answer for this is your 8th intercostal space in the posterior axillary line, because it is the most dependent position from where you can aspirate the fluid as much as possible.
Absolutely. Great. Which antibiotic for rickettsial infections?
So the antibiotic used for rickettsial infection. Hello? So can you see me?
Yeah, absolutely, doctor. Absolutely.
The chloramphenicol, sir.
Very good. Very good. Actually, tetracycline in the options would have been
yes, that would have been a better answer for this question.
Absolutely. Absolutely, doctor. Now, what are the predisposing factor for gastric malignancy? Gastric malignancy.
Sir, it's the blood group A. That is one of the predisposing factor for gastric malignancy. That's
right. So it's only the fact that gastric malignancy people, there is a greater incidence of blood group A. So, but still it is a questionable predisposition, but yeah, that's right. Once more, you need to make one big list as to what are all the predisposing factors for the gastric malignancy. Yes, absolutely. Now, what is the first step when a patient with cardiac arrest because of ventricular standstill? What do you want to do?
IV epinephrine, sir. Your CPCR has adrenaline, atropine, hydrocot, and soda backup. So you give IV epinephrine as the first step.
Absolutely. Now, a patient is homozygous and the parent is heterozygous for autosomal recessive gene. What will be the outcome?
So the outcome is 50% children are affected and the rest will be carriers, since it's a recessive disease.
So are there any points that are there in your mind that you want to tell on this context, doctor?
Sir, actually, when it comes to questions like this, we need not use a lot of our memory here. Just quickly put a table, homozygous parents, small a, and heterozygous will be a capital A and small a. Just cross over small a with two capital A, one capital A and a small a, and you'll be done. There's nothing much using your brain or a lot of time over this.
Super, doctor, super. So, Shraddha is the NEET PG topper, once more telling us the basic secrets to become a winner. This kind of questions, no need to mark. Simply exam hall में capital A, small a, capital A डालो, answer आएगा automatically. So that will decrease the burden of how many things we can remember in the life. Like the brain is very small, and no point in burdening it, right? So very good point. Now, but otherwise, there are 3 points I want to tell about the autosomal recessive. Autosomal recessive, you should remember consanguinity. Consanguineous marriages, autosomal recessive is more common. Autosomal recessive disorders are severe. There is nothing like a milder autosomal recessive. A lot of times death occur in the childhood itself. In the case of the autosomal recessive is what you need to remember. Whereas incomplete penetrance, incomplete expressivity are the features that you see in the case of the autosomal dominant is what you need to remember. Now, doctor, multiple flaccid vesicles on the leg. There is the involvement of the mouth. What is the likely diagnosis?
Yes. The answer for this is Pemphigus vulgaris, which we just discussed a while ago. That oral involvement points you towards Pemphigus vulgaris.
Absolutely. Oral involvement, think of PV, Pemphigus vulgaris. How will you remember this? PV Narasimha Rao was our Prime Minister, right? He knows around 20 to 30 languages. He's a multilingualist. That means he's oral, very vocal, right? So that's how, at least in our days, that's what I'm saying. Mnemonics of our generation are different from the mnemonics of the present generation. There are many more TikTok-like videos. You can create 3-minute videos, upload it into the Incus app, and help others to remember the mnemonics in a funny way, right? Now, doctor, pulmonary manifestation of rheumatoid arthritis.
Pleural effusion, sir.
Absolutely. Serositis is how all these connective tissue disorders present. So that is the reason we find the pleural effusion. EEG showing 3/2 spike and wave generalized discharge. So what is your answer?
So the answer, just when we glance to the question, we see the child has not lost its consciousness. So the answer to this is absence seizures, that is petit mal seizures. And all the points that are seen in this question are all, they're all high scoring points, like young child, no loss of consciousness, then lasts for 8 to 10 seconds, and the features of EEG. All these points have to be remembered.
Absolutely, doctor. Absolutely. So once more, epilepsy. Without that, do you think will there be a NEET PG exam without epilepsy, doctor?
No way, sir. And all different kind of epilepsies with different kind of appearances on EEG can be made into a table, so that you can keep on revising, and that will help you in your exams. Because any question, there are lot of chances that they give you the EEG finding, and you can quickly reach your answer.
Absolutely. So different, like the centrotemporal spikes, where do we see? So there are about 4 to 5 patterns of EEG, which you need to emphatically write at some place and remember it for the tomorrow's exam. Absolutely, doctor. So it looks like, Shraddha, 23 years I have taught the students, but first time I'm really enjoying doing once more a kind of a combined study with a topper, and in the process effortlessly. I'm very sure 4 to 5 hours also without a break. We can keep on discussing the questions. Really a very effective method. I'm very sure a lot of our competitors in coaching industry will try to follow this pattern. But who is the pioneer? Who is the pioneer? Pioneer is always Dr. Murali Bharadwaz. We start the trend and world follows it. And thank you, Shraddha, by being a good study companion. I always consider the role of a teacher. Teacher is just a companion. About 22, 23 years back, when I myself was preparing as a house surgeon for the entrance exam, I used to have around 300 students from Usmania Gandhi Medical College in Hyderabad, and we all used to study early morning at 5 o'clock in a school. I used to write on the blackboard, and in that batch, first 100 में 80 ranks आया, and I myself became a topper and got seat. So the best way to learn any day, even clinical cases also, when we all sit together and make it like a combined study, wow, it will be very interesting, and hours together we can be able to study. Thank you very much for a good beginning, and all the audience who are actively participating, Shivam, Kirtu, Anita, and many more who are all online. Now, doctor, which is not used in MI?
So the answer to this question is calcium gluconate, and it's just a common sense question, nothing much to remember. Altiplase, synectiplase you use during the process, morphine you give for the severe crunching pain of MI, and the beta blockers are core used in management of myocardial infarction. So by ruling out method, the answer has to be calcium gluconate.
Absolutely. Beta blockers decrease the myocardial oxygen demand by decreasing the heart rate. That is the reason they are basically used. Now, high fever, tachycardia, hemoptysis, lobar consolidation. What do you think is the diagnosis?
So the diagnosis is lobar pneumonia.
Yes. So pneumonias are broadly divided into 3 types. One is lobar pneumonias. The second is interstitial pneumonias, bronchopneumonias. The third type is called interstitial pneumonias, which are caused by atypical organisms like mycoplasma, is what we need to remember. Once more, pneumonia is the most high-yield topic, doctor. The types of pneumonia, the treatment, everything you have to be 100% sure.
Yes, sir.
What is the most common type of
headache? Just to add one more point.
Yeah.
Not exactly regarding the pneumonia, but any topic that has variants in it, be it like Pemphigus, be it pneumonia, be it types of headache, types of epilepsy. I think these are all what I have observed are very high yield. You just have to learn, make tables, and just remember them. That's it. What is the thing?
Absolutely. Those topics. Right. One of the toppers tip for all of us is any topic which has a variance, like pneumonia has variance, like Pemphigus has got variance. Don't forget to make a table and try to remember, because examiners question bank has a lot of questions to ask between the variance features and create MCQs. This is a golden tip, Shraddha ji, that it is very practical and very true. We should remember. I'm so happy to see 40 online classmates. Great. Let's make it viral, and every day evening at any time, please subscribe to this channel and also click on the bell sign, so that we got 500 toppers below 5,000 rank, and some of them all may not be as dynamic as Shraddha. I know that. Shraddha is both a teacher and also a good topper. Let me honestly tell you, because to teach somebody, to help somebody to learn or to crack exam is a kind of a passion that is the need of the hour. more than any plan A, plan B kind of coaching programs where commercially you pay 50,000, 60,000 like that. So once more, I like to tell all of you, 1 rupee में आपको नीट पीजी कोचिंग मिलेगा. जब तक आप सीट मिलेगा, आप आएगा, तब तक हम आपके साथ रहेगा. So that is what we are going to do, and we are going to bring lot of toppers onto this platform to do combined study with us and make you inspired to prepare for the exam. So, doctor, the next question. What is the most common type of headache?
The tension headache is the most common type of headache, sir.
Absolutely. Once more, just now, Shraddha rightly said, any topic with multiple variants. Table banao. Very, very important. यहाँ का table क्या होता है? Tension headache versus cluster headache versus migraine headache. So headache में बहुत variants है. So how do you differentiate is very important. So subarachnoid hemorrhage में headache होता है. Thunderclap headache is what you need to remember. Similarly,
yes.
Rhinorrhea, autonomic nervous system features के साथ जो headache होता है, वो headache होता है. Cluster headache is what you need to remember. Very good, doctor. Now, a 41-year-old presented with chronic diarrhea for 3 months. Deep xylose absorption test. Why do we do that?
So, a chronic diarrhea usually points us towards the mucosal disease, and we do the D-xylose absorption test to check the carbohydrate malabsorption in mucosal disease.
Absolutely. So it is the carbohydrate malabsorption which is being detected. Now, in chronic renal failure, what are the features and what not?
So, rugged jersey spine is not a feature. Rest all things are actually features of chronic renal failure.
Actually, there is one small thing we need to remember is the broadcast in the urine is because of the tubular dilatation. Similarly, impotence is another feature. Actually, the right answer, more appropriate, will be hyperkalemia is a feature, not hypokalemia.
Yes, sir.
So,
hypokalemia.
Rugged jersey spine can be seen in secondary hyperparathyroidism, and which can occur very much in case of the chronic renal failure. Absolutely. Now, doctor, adult male suffering from HIV. He had sex with a lady, and which test is important in knowing whether the lady is infected or not? What is your answer, doctor?
Yes, sir. The answer is P24 antigen, sir.
Yeah. So obviously, if you want to do screening, that particular test should have high sensitivity, not necessarily specificity. Not specificity, but sensitivity.
Yes, sir.
So that is the reason, because of that high sensitivity, P24 antigen is the one which is the most preferred, is what you need to remember. Recurrent vulvovaginal candidiasis का definition क्या होता है?
It's having more than four or more than that infections in a year.
Absolutely. So, how do you manage this kind of numerical questions? Do you used to mug all this numerical or any mantra that you want to offer?
Same, sir. You have to like eat, sleep, repeat.
Right. Now, myelopathy does not occur in
Yes. So the answer to this question is the polyneuratic leprosy, where you don't have the myelopathy as a feature there.
Right. So myelopathy होता है spinal cord का involvement. Spinal cord involvement is myelitis, myelopathy, etc. So subacute demyelination of the cord में anyway cord is involved. Syringomelia cord is involved. Tabestosis cord is involved, but not in polyneuratic type of leprosy. Now, what is the drug of choice for exercise-induced asthma?
So the answer for this is inhaled steroids, which is drug of choice for exercise-induced asthma. And asthma is also one more high-yielding topic where different kind of asthma and the pattern, the step-up pattern use of drugs can be again high-yielding topic for NEET PG aspirants.
Yes. Actually, in this, there are two things, doctor. Acute presentation, what you said, inhaled steroids or beta-2 agonists are fine, but in general, for the nocturnal asthma and exercise-induced asthma, salmeterol is a preferable drug because it is a long-acting LABA, long-acting beta-2 agonist. So that is the reason generally nocturnal asthma, exercise-induced asthma, salmeterol is preferred one. But here it is not clearly mentioned whether it is acute presentation or non-acute presentation, basically. Then one more important point, doctor. COPD patients, whenever bronchoconstriction is there, we should remember that it is the anticholinergics, that is ipratropium bromide is considered to be the drug of choice in COPD associated asthma. Because in COPD, how do you manage asthma? You need to lead to bronchodilation. Bronchodilation can occur with two kinds of drugs. What are the two kinds of drugs leading to the bronchodilation? Yeah. What are the two types of drugs that lead to bronchodilation? Bronchodilation can be achieved with either sympathomimetic drug like a beta-2 agonist or a parasympatholytic drug, either of them. So I always tell the NEET PG aspirants, autonomic nervous system pharmacology को nail down करना है, entrance में अगर top rank आना है तो. What do you say, Shraddha?
Yes, sir. Autonomic nervous system is also like one more high yield topic that can give you n number of MCQs to solve, and actually it's more interesting rather just to learn it for MCQs. I feel it's one of the interesting topic when it comes to pharmacology. Autonomic nervous system is just like playing with features, whether this occurs or it doesn't occur, this affects or does not affect. It's just like saying yes or no.
Absolutely right, doctor. So now, burst suppression EEG pattern. Where do we see, doc?
So this is a feature of myoclonic epilepsy, as we just discussed, like ECG patterns and various types of epilepsies can be your high yielding
topic. Very good. And about the myoclonic epilepsy, one important thing we need to remember is called salam spells. Salam spells. So what happens is the child will be sitting on the breakfast table and suddenly he loses the tone and then he will come down, just like Nawab ko salam karte na paisa. So salam spells need to be remembered. So where do we see all rods, doctor?
Hello, yes sir.
Yeah, you are audible, doctor?
So are you getting my voice?
Yeah. One add to the stream. Now you are audible. Yes.
Yes, sir. The answer for this question is AML M3. Very typical question. Every now and then, I think every alternate year, some or the other question, they will ask you all rods, video, a question somewhere without all rods. I think the exam is actually incomplete.
Absolutely, doctor. So basically, acute promyelocytic leukemia, APML. Of all the leukemias among the AML subtypes, best prognosis and also the response to treatment, we use ETRA, that is all trans-retinoic acid as a part of the treatment for the management of the APML. So that is the reason it has got a good prognosis. But the main challenge with the APML is it leads to disseminated intravascular coagulation. And that is the reason the prognosis can go bad. That's the reason whenever APML patient, acute promyelocytic leukemia patient joins you, you should make sure that the blood bank is well stocked with fresh frozen plasma and all the blood products. Otherwise, the patient goes into DIC, we don't have good blood bank support. There's a great chance of losing the patient. But otherwise, if you can timely start the ETRA, then the patient will have a very good prognosis is what you need to remember. Very good, doctor. Now, cystatin C, where do you use?
Sir, it's actually a recent newly developed marker for diagnosis of acute renal failure. So it's like one of the recent updates that has come in ARF.
Absolutely. So cystatin is one of the important recent markers for the acute renal failure. Increased VMA, I think this is a biscuit question.
So basic question, sir, it's seen in pheochromocytoma, increased vanillin mandelic acid.
Absolutely. A 20-year-old girl with pain in abdomen, purpuric rash all over the body.
So the answer for this is henoch-Norin purpura. And again, similar, all these young children involving autonomic disease it's again high yield topic in pediatrics as well as medicine.
Absolutely. So you remember, doctor, what is the famous clinical vignette about the henoch-Conlin's purpura? Typically, it is also called, it is the other end of which condition? IgA nephropathy.
IgA nephropathy, yes, sir.
Of the spectrum, doctor. So, henoch-Conlin purpura is a vasculitic purpura. So that is the reason it is a palpable purpura. What is the other cause of the purpura, doctor? What is the common reason where do you find the purpuras? Whenever there is
simple thrombocytopenia.
Correct. Simple thrombocytopenia can lead to the development of purpura, whereas thrombocytopenic purpura is not a palpable purpura, whereas vasculitic purpura is palpable purpura. That's the point we need to remember. So the last question for today's evening, this wonderful evening with Dr. Shraddha, who is with all of us, and also so many thanks to all the online audience who joined the session. Wide fixed split S2. Where do we see, doctor? Split S2. Where do we see, doc?
Hello? Yes, sir.
Wide fixed split. Where do we see, doc?
It's seen in atrial septal disease, sir. It's the one of the very specific question when it comes to ASD. It can also be ASD, VSD, TOF, and TAPVC. We can have a comparative study on all these topics.
Absolutely. TOF, TAPVC, and ASD and VSD are very close congenital heart diseases. Now, typically A2 occur first and P2 occur later. A2 is always first and P2 is later. So, if you look at the left heart, left atrium, this is left ventricle, right atrium, right ventricle. So the left ventricle pumps into aorta and aortic valve closes first compared to the right ventricle, which pumps into pulmonary artery. So the closure of the pulmonic valve is versus that of the aortic valve if we take, because there is a very high pressure difference between left ventricle and aorta, A2 first followed by P2. But typically what happens in ASD and what happens during inspiration, first of all? Inspiration. In inspiration, there is a negative intrathoracic pressure. Because of that, the blood is sucked more into the right side of the heart and more amount of blood goes from the right atrium into right ventricle. So normally only A2 is followed by P2 with some delay. and during inspiration, this delay become longer between A2 and P2. But whenever there is an ASD, the left atrial blood is flowing into the left ventricle already. Left atrial blood is flowing into right atrium already. So that is the reason whenever the inspiration occurs, the right atrium will say, already I have blood coming from left atrium. I don't want to take any more blood from you because already I am full with pressure. So that is the reason the normal inspiratory widening that we see in inspiration जो भी widening होता है वो नहीं होगा अगर ASD है तो, क्योंकि राइट एट्रियम इंस्पिरेशन टाइम में ज्यादा ब्लड लेने के लिए तैयार नहीं है, मना करेगा, क्योंकि ऑलरेडी लेफ्ट एट्रियम थ्रू ASD has pushed blood into it. It is already under high pressure, so that is the reason it don't want any more extra blood. That is the reason the A2P2 gap remains fixed. It won't change during inspiration. So that is what we need to remember. One more question, we will end this session. What are the features of hypothyroidism, doctor? Yeah, I think we are out with Shraddha, must be on a call. Yeah, so you should remember the edema, cold skin, etc., etc. They're all the features of the mixed edema is what we need to remember.
Mixed edema, sir.
Yeah,
yes, sir. The answer for this is yes, sir.
Yeah. So once more, doctor, thank you so much for this wonderful evening and so many tips, and in spite of a duty with the patients on the other side, even
really sorry for all the interruptions, sir. There is actually a lot of ruckus going around me, but I'm sorry for all the interruptions, and hopefully next time whenever I plan my session, I adjust my duties as much as possible.
Excellent, excellent. So thank you very much, and once more, every day, let us all meet up 1 to 1.5 hours. We will have Chai Pe Chircha with a NEET PG Topper, and that gives us a lot of solace, confidence, energy to prepare. And we wish you great, good luck for Dr. Shraddha, who is going to be our future neurosurgeon from Aurangabad. You are originally from which place, doctor? MBBS from which medical college?
Sir, I did my MBBS from Shri B.M. Patil Medical College, Bijapur, Karnataka.
Oh, I see. You are very close to our Hyderabad because you are from the adjacent Karnataka. So that's good. That's good. Wonderful. And Deepak is asking a question, sir, when is the next class? We are all enjoying this class. Tomorrow evening once more. And if Dr. Shraddha can get time, we will catch up. Otherwise, we have Dr. Soni, who is also once more another surgeon who is a topper in NEET PG. So depending upon which NEET PG topper has a time available, we will try to arrange every day evening a discussion on your favorite YouTube channel. Good night and thank you so much.
It was actually a great time I had after a long time of these depressing COVID duties. So I actually have to thank you for giving me this opportunity, sir.
Sure. Thank you, doctor. Yeah.
Thank you, sir.